105 on the Buzz, Daria, Mitch, and Ted. And look who's here, cosmetic surgeon and general all-around great guy, Dr. Michael Workman.
Where are these? Is the restaurant these Sundays are from?
Urban Farmer.
In the nines, right?
The hotel?
Yeah,
thing?
hotel.
Is that where it is?
Yeah.
It's on the the upper top.
Just relax.
It's the main
Eighth
floor.
floor.
I've
Eighth
eaten a
floor.
lot of this dessert, and I'm
Eighth
pepped up.
floor. Yeah.
Yeah, beautiful hotel,
You are. You're like
beautiful restaurant.
You're like in a sugar mania.
I don't eat like any sweets, you know. I rarely have any sweets, and this stuff is good.
As far as sweets go, this is really sweet.
It's the best I've ever had.
So he brought us all sundaes in this little,
Butterscotch.
and it's probably a good time to talk about liposuction.
Absolutely.
I get what you're trying to do here. Yeah,
Job
I don't
security.
think I don't see it. Okay, so liposuction is one of those things I think that there's a lot of misinformation about and a lot of like sort of fears as to what it entails or confusion. So while
we enjoy a butterscotch
while we eat our
sundae.
butterscotch sundaes. Let's talk a little bit about it. Where is liposuction generally? Well, first of all, how long has it been around as a thing? Like, it seems like one of those things where, hey, I know, we've got extra fat. What if we
Just suck it out.
What if we just suck that fat right out? And then, like, to actually go from that notion to actually doing it seems like wild to
Yeah.
me. How long has it been a noted procedure?
Since the 1970s, there was a French gynecologist who started experimenting with it. His name was Illouz, I-L-L-O-U-Z, and nobody at that point believed that you could take fat out and expect the skin to contract around it. It was like heresy, and he started doing that, and he started doing it safely, and he started the kind of the liposuction craze. I mean, it's now the number 2 plastic surgery in America.
What's number one?
Boobies.
Oh, that's right.
Boobies.
Yeah.
So where are the areas where it's most typically performed?
The most common areas on women are the saddlebags, which is the area outside the buttock, the abdomen, and the flank. And in the men we call it the love handle area.
Where else though can it be done?
It can actually be done anywhere. I mean, I think in general it's designed to take off fat in those areas where we have extra fat cells. Okay, oftentimes moobs, man boobs. But we can actually contour and we can reduce the fat thickness anywhere in the body.
And is it true once the fat is removed from that area, it will not come back to that area?
That is true. It is urban legend, and I get this about every other day that the fat cells went to my arm, but they don't. They don't go to your arm.
Okay.
But if you gain weight, they'll go somewhere.
It's got to go
Yes.
somewhere.
Right? I mean,
Yeah.
Yep.
So that might be why it appears that way.
Yep.
Now, if you are extremely overweight,
Yep.
then liposuction is not going to you're not going to go in and get liposuction and come out skinny.
No, absolutely not.
Why?
Because there's a limit to how much we can take off safely. And some universities will actually go in and, they'll keep patients overnight, put Foley catheters in, and, do a massive removal. But in general, you're not going to take off more than 5 or 10 pounds max.
Really?
Yeah.
So what happens when you go in for liposuction? You go in, you are under sedation, and then what's the next step?
Well, what we do is, obviously you're prepped. It's in an OR, and we then make some very small incisions. They're about 1/4 of an inch, which allows us to put tumescent fluid, and basically that's just Novocaine and adrenaline. And what that does is it, not only numbs the area, but the adrenaline keeps it from bleeding.
Wow.
Yeah.
And then there's like a vacuum device, I guess. What does it look like?
It's basically a pump, and it's basically it's 120 volts, and if we want to take off twice as much, we put it in the 220 volt outlet.
I don't know. See, I didn't know if that was real or not.
No,
I totally
not.
didn't. He was totally stone-faced. And how do you know that you're taking out fat and not
Not
other
someone's
stuff?
heart.
Well, it's experience. You can tell, there's a feel to it. Going through fat, it goes, generally the cannula goes much easier. One of the complications is to go through, let's say, the abdominal muscles or into the chest cavity. But the chance of that happening in experienced hands is probably 1 in 100,000.
Yeah, I saw a creep show where that happened. It was like a husked
Don't like
raisin.
that. What always scares me about it, I've seen it on television on different shows, and it looks like they're just going at it. It looks like they're chopping wood
It's
or something
quite
like
physical, isn't it?
It can be physical, yes. It can be physical. But I think that, I mean, fat doesn't have nervous, intervention, and so it usually is not very painful. Sometimes you'll just get a little bit bruised, and, I mean, big deal the surgeon's working his tail off.
So when you wake up, you feel like you've done a bunch of sit-ups maybe or something? Or?
Yeah, what do you feel like afterwards?
Me or the patient?
The patient.
Oh, I'm sorry. I actually had tendonitis one day. I did so many I kid you not. I had tendonitis in my elbow. I had to take Motrin, and patient tends to feel like they are in a fight. It feels like the worst workout you've had. You've done 500 sit-ups, and
I wouldn't know that
bruised.
feeling.
Yeah,
give me something else to relate to.
Yeah.
I ate too much chili, something maybe like that.
Hangover.
Okay.
Yeah.
So, and how long? And then you have to wear a compression garment, right, or something binding.
Exactly, and it's not unlike, let's say you sprain your ankle. If we put an ACE wrap on it, it gets the tissue fluid out of there quicker. And especially with liposuction, if you're a little older and your skin isn't quite as elastic, we really want to compress it down and allow it to contract the maximum amount.
Okay, what if you go in and you have liposuction done on, say, your abdomen, and you take a maximum out and it's shrunk down that area, but your skin doesn't contract the way you hoped it would, and you have a lot of loose skin? That's probably not too frequently because you probably go just a little bit at a time, but if that happens, then you can trim that skin away, can't you?
Right. I mean, and I see probably 1 or 2 patients a month where people have taken off too much fat, and inevitably we either have to put a little more fat in, but most often we remove some of that extra skin, so that if a person takes off too much fat, the skin tends to hang. It's more like a Shar-Pei dog, and we end up going in and just removing that extra skin.
And here's a question that has been surfacing by actual would-be patients and comedians for a really long time. But that is, why can't you just take fat off the tummy and put it on the boobs or butt?
Well, we actually can. We actually can, believe it or not. And that's one of the controversial techniques in plastic surgery right now.
So it's not common.
Well, it's becoming more common, and I just saw an article today about using a combined breast implant with liposuction for breast augmentation.
Have you tried it yet?
No, I haven't. Yeah, you never want to be the first one on the
That's
block
exactly-
to try something.
Definitely not.
exactly
Nor the last.
what I
Yeah,
know.
but I mean, you can actually do both implant and fat transfer.
That's wild.
Yeah.
Is that exciting to you as a doctor when these new procedures and stuff, or do you get nervous and go, oh God, something else
to learn.
Well, no, no, it is exciting. I mean, we're pushing the envelope, we're getting better results, and that is exciting.
You can check out Dr. Michael Workman's website at drmichaelworkman.com. You can link there from our website as well. Find before and after photos of procedures that he's performed with actual patients, and you can see for yourself the changes that can be made with procedures such as liposuction and all the other procedures that Dr. Michael Workman does. Pretty much everything from the neck on down
He's
to
the
help you
man.
look and feel better about yourself. drmichaelworkman.com. You can also schedule appointments on that site, find out more information, even stuff about payment options, etc. And you can see Dr. Workman, or rather hear him, back here. Actually, you can see him.
Yeah, we're
Our boy is
videotaping.
videotaping him right now. So go to our website if you want to see what our man looks like in action.
He's a handsome devil.
You'll notice today. Yeah, you'll see today's.
He's
Oh
making
my God,
faces
you're
at
a
the camera.
child.
You think?
You'll know today's video by the fact that there's a big ass sundae from Urban Farmers in front of him. Thanks, Doc.
My pleasure.
It's Pink on the Buzz.